we're going to be talking about the Thomas test. The Thomas test is a postural assessment that measures the flexibility of the 1 and the 2 joint hip flexors. The 1 joint hip flexors being psoas and iliacus, the 2 joint hip flexors being rectus femoris and sartorius. It does go a little bit more in depth, but at the moment we're in certificate 3 level, so we're just going to be just concentrating on the 1 and the 2 joint hip flexors today. So a couple of things that you would need to be wary of if maybe on the test that the joint may be tight. If the psoas and iliacus muscles are tight, it could be an indication of another postural condition, possibly anterior tilt of the pelvis or lordosis. The postural condition, the postural effects that may occur from that is maybe a decreased firing of the gluteal muscles and the hamstrings, and maybe a weakening of the abdominals as well. These are the things that you would look at and fix up in a postural assessment. So the hip flexors would obviously need to be getting more flexibility, and you would need to strengthen the glutes and the hamstrings. Conversely, the 2 joint hip flexors, once again being rectus femoris and sartorius, if they are tight, they would need extra flexibility as well, because they may also cause adverse postural conditions. So now we're going to go into the postural assessment of the 1 and 2 joint hip flexors of the Thomas test. So what we're looking to do now is get our client to come in, grabbing a seat on the massage table, which is a great tool to use for postural assessments, making sure that the tailbone is flat on the edge of the bench. Now Nick's going to grab his left knee with both hands and lay back flat on the massage table. As a client, you need to make sure that they are flat with their back against the table. As a trainer, you make sure that they are in that correct position. So you need to manipulate them so that you feel that their back is nice and flat against the bench. When we've got our client in the correct position, we are now looking to assess the 1 joint hip flexors to start. So the 1 joint hip flexors being psoas and iliacus, if tight, you will see that the knee joint is higher than the hip joint, or the bottom of the leg comes off the bench. So that would be classed as a tight 1 joint hip flexor in a test. As you can see though, Nick's knee is actually lower than the bench or lower than the hip angle, so his 1 joint hip flexors are at an adequate range of movement. If we looked at the 2 joint hip flexors and we just angle the camera down a little bit, you're going to see rectus and femoris that both come over the knee joint. When they are tight, you will notice that the knee will extend slightly. If they are at their normal range of movement, it would be between 90 and 80 degrees range of movement from the knee to the ankle. So once again, if the 2 joint hip flexors are tight, you will see the knee starting to straighten. Normal range of movement again, 80 to 90 degrees. So that is our Thomas test looking at the postural assessment.